Is it possible to get pregnant naturally at 42 with low AMH? That's the question so many women ask me. And the answer they usually get from their clinic is no. Your age is working against you. Your AMH is just too low. IVF is your only option, and even with IVF, you might still need donor eggs. But I want to show you a different story today. A real story from a real woman in my HOPE program who just got pregnant naturally at 42 after being told IVF was her only path forward. Her name is Alexis, and what happened with her is the exact reason I'm making this video. Because what we found that was blocking her fertility is something her fertility clinic never tested for. And if she had rushed into IVF without addressing it, IVF might not have worked either. I'm Dr. Marc Sklar, also known as the fertility expert. For over 24 years, I've specialized in helping women over 40 optimize their fertility naturally and prepare their bodies for successful pregnancies, whether that's through natural conception or through IVF with the best possible odds. And in today's video, I'm going to walk you through Alexis's complete story. What her fertility clinic missed, what we found, the exact protocol we used, and how she's now 11 weeks pregnant naturally at 42. I'm also going to talk about when natural conception makes sense for women over 40 and when IVF is the better path, because I want you to make informed decisions based on your specific needs and situation. Before we get started, if you want actionable strategies right now, I've created a free guide called The Proven 6 Ways to Improve Egg Quality in 90 Days. You can grab that in the description below. Now, let's dive into Alexis's story. Alexis came to me after she'd already done all the testing for IVF. She'd been to her fertility clinic, they'd run her labs, AMH, FSH, baseline ultrasound, the standard panel. They'd confirmed she had low AMH for her age, and they told her what they tell most 42-year-old women with low AMH. We should start IVF as soon as possible. Time is not on your side. Now, I'm not anti-IVF. I want to be very clear about that. IVF is an incredible tool that helps many women become mothers, but it's not always the first or only option. And it's definitely not always the right next step without proper investigation. Alexis had this feeling deep down that something else was going on. She'd been trying for a while. She'd done all the tests for IVF, but she felt like nobody was actually looking at her whole body. Nobody was asking, why isn't your body conceiving naturally? What's blocking it? So before starting IVF, she joined the HOPE program, and I'm so glad she did. Here's what we found. Alexis was on a Candida protocol when she got pregnant. She'd been struggling with Candida overgrowth that her fertility clinic never tested for and never addressed. Now, let me explain why this matters so much, especially for women over 40. Candida is a type of yeast that naturally exists in your body. But when it overgrows, usually due to diet, stress, antibiotic use, hormonal imbalances, it creates systemic inflammation throughout your entire body. This inflammation affects everything: your gut health, your immune system, your hormone metabolism, your ability to absorb nutrients, and absolutely your fertility as well. When you have chronic Candida overgrowth, your body is in a state of constant immune activation. Your gut lining becomes compromised. You're not absorbing the nutrients you need for egg quality. Your hormones aren't being metabolized properly, and your body is prioritizing dealing with this infection over reproduction. Your body is essentially saying, I'm under attack. Now is not a safe time to get pregnant. And here's the thing. Fertility clinics almost never test for this. They're looking at your ovarian reserve, your hormone levels, your uterine environment from a structural perspective, but they're not looking at your gut health, your inflammatory markers, your microbiome. So Alexis could have done IVF with untreated Candida overgrowth, and her chances of success would have been significantly compromised. Not because of her age or her AMH, but because her body wasn't in a state to support implantation and early pregnancy. This is exactly why I always say, before you jump into IVF, especially if you're over 40, you need to make sure your body is actually ready. Not just your ovaries, your entire body. So here's what we did with Alexis. First, we confirmed the Candida overgrowth through proper testing. We ran comprehensive stool analysis that showed significant yeast overgrowth and gut dysbiosis. Then we put her on a targeted Candida protocol. This involved several key components. Number one, dietary changes. We put Alexa on an anti-Candida diet that eliminates all the foods that feed yeast. No sugar, no refined carbohydrates, no alcohol, no fermented foods initially. We focused on clean protein, healthy fats, lots of vegetables, and specific antifungal foods like garlic, coconut oil, and oregano. Number two, antimicrobial supplements. We use specific natural antimicrobials that target Candida, things like oregano oil, caprylic acid, berberine, and specific probiotic strains that compete with yeast. Number three, gut healing support. Once we started killing off the Candida, we needed to repair her gut lining with nutrients like glutamine, zinc, carnosine, and aloe vera. Number four, supporting her detoxification pathways so that her body could effectively eliminate the dying yeast and the toxins they release. Number five, maintaining her fertility-focused nutrition and supplementation alongside the Candida protocol. We didn't stop focusing on egg quality and hormone support. We were doing both simultaneously. Now, Alexis asked me, as many women usually do, can I try to conceive while doing the Candida protocol? And here's what I told her. Generally, during the initial intensive phase of Candida protocol, which is usually the first 30 days, I prefer not to have couples actively trying because the body is in detox mode. We're clearing out infections, releasing toxins, and I want that process to happen without the complication of early pregnancy. But after that initial phase, if you're feeling better and your gut symptoms are improving, then you can start trying while continuing the maintenance protocol that addresses Candida. And that's exactly what happened with Alexis. She started the Candida protocol. She was compliant. We stuck to the diet even though it was challenging. She took her supplements consistently. She did the work. And 1 week into her personalized fertility protocol, which we implemented after the initial Candida treatment phase, she got pregnant naturally at 42 with low AMH because we addressed the root cause that was blocking her fertility. Now, here's her message to me when she found out. I never thought I would be writing this, but I just found out on Friday that I got pregnant naturally. I'm convinced it's because we treated the issues the Fertilysis test found. She goes on to talk about what she's doing now to support her pregnancy, taking a high-quality prenatal, vitamin D, eating locally caught fish 3 times a week for those omega-3s instead of fish oil supplements, because she prefers food as her main source, continuing weekly acupuncture, staying on her organic, homemade, clean diet, and asking me if she could continue her probiotics. The answer was yes. Absolutely continue the probiotics. Absolutely continue supporting your gut health throughout the pregnancy. Now let's talk about what happens once you do get pregnant at 42, because this is also important. Alexis asked about continuing the probiotics during pregnancy, and she was slightly worried because she had been on a strong Candida supplement protocol just weeks before she conceived. Here's what I told her. And this is what I tell all the clients that work with me. If you conceive during any kind of detox or treatment protocol, you stop intensive antimicrobials immediately. We don't want you doing heavy detox or antimicrobial protocols during early pregnancy. But the foundational support, the probiotics, the prenatal vitamins, the nutrient support, the anti-inflammatory diet, all of that continues. In fact, it becomes even more important. Pregnancy at 42 is considered advanced maternal age. And I know that that term is frustrating because it makes you feel old. But from a medical perspective, it just means we need to be more attentive and proactive about supporting your body and your baby during that time. Here's what that looks like in the HOPE program. Number one, comprehensive prenatal nutrition. Not just any prenatal, a high-quality methylated prenatal that your body can actually absorb and use. Alexis mentioned she's using Designs for Health, which is a great brand. I would also recommend Thorne if you need an alternative from that. Number 2, vitamin D optimization. This is critical for pregnancy, and most women are deficient in it. We want your vitamin D levels between 50 and 80 for optimal pregnancy outcomes. Number 3, omega-3 fatty acids. Alexis prefers eating wild-caught fish 3 times a week instead of taking a fish oil. And that's perfectly fine if you could find high-quality, low-mercury fish. Things like wild salmon, sardines, anchovies, those are excellent sources of food-based omega oils. If not, a high-quality fish oil supplement is essential. Number 4, probiotic support. Absolutely continue your probiotics throughout the pregnancy. Your gut health during pregnancy affects your baby's immune system development, their microbiome, and even their long-term health outcomes. Number 5, continue the dietary support. Alexis is staying on her organic, homemade, clean diet, and that's exactly what I want to see from all of you. Pregnancy is not the time to relax on your nutrition. This is when your baby is being built from the ground up. Number 6, stress management and support. Alexis is continuing weekly acupuncture, which is amazing. Acupuncture during pregnancy helps with anxiety, supports healthy blood flow to the uterus and placenta, and can help prevent complications. Number 7, proper prenatal care with providers who understand advanced maternal age. You want a provider who's going to be attentive without being fear-mongering. Someone who monitors you appropriately without making you feel broken. Now, Alexis mentioned she's worried about unprotected sex after treatment because they only had unprotected sex once after her treatment ended, and that's when conception happened. She's worried she didn't even get enough time to make necessary changes. Here's what I want you to understand about that. If you conceive, your body's ready. Your body doesn't conceive when it's not ready. The fact that conception happened means your body is in a good enough place for that to occur. Could there be residual toxins from the Candida die-off? Potentially. But your body has protective mechanisms. And the fact that your gut was healing, that you'd completed the intensive treatment phase, and that you conceived naturally suggests your body was ready. The most important thing now is to continue supporting your body, supporting that pregnancy, and trusting that your body knows what it's doing. Now, I want to address the bigger question that I know many of you are asking. Marc, is natural conception actually realistic for me at 42? Or am I wasting time by not doing IVF? This is a critical question, and the answer is, it depends. Here's when I think natural conception makes sense for women over 40. Number 1, when you're still having relatively regular cycles and you're ovulating. If your cycles have completely stopped or you're only ovulating sporadically, natural conception becomes much more difficult. Number 2, when there are identifiable root causes that haven't been addressed. This was Alexis' situation. We had untreated Candida that was sabotaging her fertility. Once we treated it, her body was able to conceive. Number 3, when you haven't been trying that long with properly timed intercourse. Many women over 40 think that they've been trying for a year, but when I dig deeper, I found out that they weren't tracking ovulation accurately. They were timing intercourse incorrectly, or there were months where they didn't actually have intercourse during their fertile window. Number 4, when you're willing to optimize your health for 3 to 6 months before conception. This means addressing diet, supplements, lifestyle, stress, sleep, environmental toxins, all the things that impact egg quality and fertility. Number 5, when male factor is not severe. Remember, fertility is 50% male factor. If your partner has severe sperm issues, natural conception might not be realistic, regardless of your age. Number 6, when you have time. If you're 42 and you have 6 to 12 months to try naturally before considering IVF, that's a different situation than if you're 44 and feeling the urgent pressure because you know your window is closing. Now, here's when I think IVF makes more sense as a first-line approach. The first one is when your FSH is very elevated. At that point, waiting 6 months to try naturally might mean losing your chance entirely. Number 2, when you have structural issues that prevent natural conception, blocked tubes, severe male factor requiring ICSI, severe endometriosis. Number 3, when you've already tried naturally for 12 plus months with properly timed intercourse and optimized health, and it hasn't worked. Number 4, when you've had multiple early pregnancy losses and you want PGT testing to screen embryos before transfer. Number 5, when you're 44 and older and time is truly of the essence. But here's what I want you to understand. Even if IVF is the right path for you, you should still optimize your body first, because IVF success rates over 40 are heavily dependent on egg quality. If you go into IVF with untreated inflammation, gut dysfunction, nutrient deficiencies, hormonal imbalances, your chances of success drop significantly. So whether you're trying naturally or doing IVF, the same foundational work needs to happen. You need to create the healthiest possible environment in your body for conception and pregnancy. Alexis mentioned in her message that she's convinced it's because we treated the issues the Fertilysis test found. Let me explain what Fertilysis is, because this is a test I use frequently in the HOPE program, especially for women who've had unexplained infertility or recurrent losses. Fertilysis is a comprehensive microbiome test that looks at your vaginal and uterine environment. It tests for infections, bacteria, yeast, and other organisms that can prevent implantation or cause early pregnancy loss. Standard fertility clinics don't usually run this test. They might do a basic vaginal swab if you have symptoms, but they don't do comprehensive microbiome analysis of your reproductive tract. And here's why this matters. Your uterine environment needs to be receptive for an embryo to implant and thrive. If you have chronic infections, dysbiosis, or yeast overgrowth in your vagina or uterine cavity, it creates an inflammatory environment that's hostile to pregnancy. We found Alexis's Candida through a combination of her GI testing and her Fertilysis results. And once we treated it systematically, her body was able to conceive. This is exactly the kind of comprehensive testing I do in the HOPE program. We don't just look at your ovarian reserve. We look at your entire body as a system. We find the root causes and we fix them. So if you're sitting here watching this video and you're 40, 41, 42, maybe even 43 or 44, and you have low AMH or diminished ovarian reserve, and you're wondering, what should I do? Is natural conception possible for me? Should I do IVF? How do I know? Here's what I want you to do. Number 1, get proper testing done, not just the standard fertility panel. Comprehensive testing that looks at your gut health, your inflammation markers, your thyroid function beyond just TSH, your nutrient status, your hormone and immune function, your microbiome. Number 2, address any identified root causes. Don't just accept everything looks normal if you're not getting pregnant. Normal doesn't mean optimal. And if there are underlying issues like Alexis's Candida, they need to be treated before you can conceive, whether naturally or through IVF. Number 3, optimize your egg quality for 3 to 4 months minimum. It takes about 90 days for an egg to mature from the time it's recruited until ovulation. So any improvements you make now will affect eggs you ovulate 3 to 4 months from now. Number 4, track your cycles properly. Make sure you actually know when you're ovulating and that you're timing intercourse appropriately. Number 5, work with someone who specializes in infertility over 40 and who takes a comprehensive functional medicine approach. This is exactly what I do in the HOPE program. We assess your complete picture. We identify root causes. We create a personalized protocol. We optimize your body whether you're trying naturally or preparing for IVF. And we support you every step of the way with weekly coaching calls, a community of women going through the same thing as you, and direct access to me and my team. If you're ready to find out what's possible for you, I want to invite you to book a complimentary personalized fertility assessment with my team. On this call, we're going to review your complete fertility history. We're going to look at your age, your AMH, your test results, your history. We're going to have an honest conversation about what makes sense for you, natural conception, IVF, or optimizing for IVF. We'll identify what tests haven't been run yet. We'll talk about potential root causes, and we'll map out exactly what your next steps should be. This isn't a sales call. This is a genuine clinical assessment. And at the end, you'll know whether the HOPE program is the right fit to help you achieve your dream of becoming a mom. You can find the link to book your assessment in the description below. Here's what I want you to take away from Alexis's story. Age matters. AMH matters, but they're not the whole story. If there are underlying root causes causes blocking your fertility, gut dysfunction, inflammation, hormonal imbalances, infections, anything. Those need to be addressed regardless of whether you're trying naturally or doing IVF. And for some women over 40, natural conception is absolutely possible when we address what's really going on. Don't let your age alone determine your path forward. Get proper testing, address root causes, optimize your body, and then make an informed decision based on your complete picture. But before you go, hit that like button, subscribe to this channel, and turn your notifications on so that you don't miss any future videos from me. And leave a comment below. Tell me how old you are, what your AMH is, and what path you're considering. Let me know where you are on your journey. Remember, your age is just one factor. Let's find out what else is going on so you can make the best decision for your unique situation. Until the next video, stay hopeful and stay fertile.